Hi everyone, welcome back to UWorld's Next Gen NCLEX review. My name is Samantha. I am a nurse here at UWorld, and I am so excited to be back with you all today. Thank you so much for joining. So today we're going to be highlighting the pediatric population. We have so many requests for pediatric content, and we want to help meet those needs with today's lecture. So we're going to actually walk through the milestones of childhood development from ages 1 to ages 3. When I remember back to my pediatrics classes during nursing school, these developmental milestones were something that I always really struggled with. They can really seem like they start to all blend together, especially for those of us who do not have kids yet. Sometimes this topic can just feel a little bit foreign, but today's lecture I broke up into digestible segments to really help this information soak in for you all. A couple of call outs before we get started. We do take into account the topics that you all want to see. So keep letting us know in the chat what suggestions, what recommendations you have for us for different lectures to do. And also for questions throughout today's video, make sure you drop them into the chat. Any answers also drop in the chat. We have the wonderful nurse Jasmine standing by, moderating, ready to answer any questions that you all have. So this live will be on demand after we are done here today. So if you join late, if you have to duck out early, no worries. You can look at any of our social channels to find it reposted later. Personally, I find our YouTube channel as the easiest of our channels to search. So make sure you drop your questions, answers, comments into the chat. Let's get that chat started by letting us know where everyone is joining us from. Who here is joining us internationally? Who is a US viewer? Let us know. It's always so interesting to see how far and wide our audience reaches. So with that being said, that will get our chat started off. I already see somebody from New York. Welcome. We're happy to have you. We're going to start our lecture content today chronologically. So we're going to start with the age of 12 months, move up to 30 months, and then 36 months, because again, it's ages 1 through 3 developmental milestones. So let's start out with some preliminary information. We're going to switch to our Erik Erikson theory image. So psychologist Erik Erikson introduced the theory of psychosocial personality development in the 1950s. So it's been around for a while. It explains how each stage of life develops and the main issue that each age group is facing. For the ages of 1 through 3 that we're going to be covering today, also referred to as the toddler age, the main issue they're facing is autonomy versus shame and doubt. So autonomy is another word for independence. Here we want to see these young kids develop independence and self-sufficiency, and we do this and we foster this if we allow them to explore, to try things on their own, to step forward, and if they fall, you have to kind of let them, because it encourages them to get better, to learn, and most importantly, to gain confidence. If these kids are not allowed independence, or they're very often scolded or held back from trying new things, they can unfortunately develop shame and doubt instead of that autonomy, which will contribute to insecurity and self-doubt later in life. A couple of call outs for things that we see during this 1 through 3 age group is something called parallel play. So around toddler age, children begin to exhibit something called parallel play. It means playing on their own while sitting next to or close to another child. They start to observe the other child. They may even mimic the other children, but they're not necessarily playing together. They're doing their own thing, just in close proximity. Object permanence, also a big thing that develops during this age range. Children start to develop object permanence, which they previously lacked as infants. It means that if you take an object away from them, out of their sight, they're still able to realize and understand that the object still exists. It's just not immediately around them. So if you hide something, maybe a toy, a pacifier, a bottle, or a comfort item, they may cry for it. They may start to look for it and try to find it. Here at this age, we're also getting increasingly observant. Children may mimic things that you do or say, so we do have to be very careful about what we say. And toilet training, also a really big milestone between the ages of 1 to 3. It's important to observe for signs of readiness for toilet training. As a general rule of thumb, girls will typically begin to show readiness a little bit earlier than boys. This typically develops around 18 to 24 months, but we do see some kids that are really ready to do this ahead of that 18-month milestone. And we are going to cover this in depth at the end of today's material. So bookmark it for now. Alrighty, so let's move on to our 1 year and our 15-month developmental milestones tables. Again, any of these things that we put up for you guys, you're free to screenshot, take a picture, take it with you, save it for your future studies. While we put this up, I'm going to go ahead and jump into our chat. Let's see what you all are. I think I see lots of Nairobi, Kenyas. I see some Dubai, Ohio, Nigeria. Welcome. Thank you so, so much. All righty, thank you for joining, and some questions I think about the UWorld app. But thank you everyone for joining. Regardless of where you are joining from, we are so happy to have you here. That is the beauty of the World Wide Web. You can join from wherever you are. So 12 to 15 months, what are some big milestones here? So let's look at our gross motor skills. Our larger muscle groups here are starting to get a little bit stronger. Here we see kids start to take their first independent steps, and they do something called cruising, which means they take a few steps. They may be stumbling a little bit. They may have to hang on to a caregiver or a furniture piece like a chair or a couch. They start this process around the age of 12 months, but they're able to do it more independently by the age of 15 months. So we see it start out in its infancy at 12 months, and it's progressing a little bit more by 15 months. Fine motor skills also start to develop. So at 1 year, we start to see that fine pincer grasp, meaning they're able to hold something between the thumb and the forefinger. This is going to allow them to eat a little bit more deftly, pick up little small things like a grape or a small piece of fruit or vegetable. At 15 months, they can also begin to place blocks on top of one another independently. So these fine motor skills start to get further developed. Language, how is their language progressing? At 1 year, most of these infants are going to be saying things like mama or dada. It's pretty simple. By 15 months, we're adding about 1 to 2 words on top of that. Again, they'll be pretty simple, but we are gradually expanding that vocabulary. Regarding social and cognitive skills, at 1 year or 12 months, we start to see the nonverbal gestures develop. Things as simple as waving goodbye. At 15 months, these children are now able to follow one-step commands with a gesture. So if you say something like, go get your socks, and then point to the sock, they'll be able to understand and follow that command. Now, they're not going to listen to you every time, but they're getting a little bit better. And at 15 months, we see these young kids start to show a little bit of affection. So they'll start to hug and maybe kiss a caregiver or a parent or another family member. All right, so moving on to 18-month developmental milestones. How are they progressing at 1.5 years? So looking at gross motor skills, here these infants are able to walk a little bit more easily and independently. They're not cruising versus they're kind of walking more independently on their own. They don't need to hang on as much to caregivers or furniture as they used to. They also start to climb up on furniture. So another reason we have to make sure our houses are well baby-proofed. Fine motor skills will also start to develop. So these 15 or 18 months old, can hold a pencil or a crayon. It's not going to be that deft, but it's going to be like a rude grasp and scribble. So they'll scribble with a crayon or a colored pencil. They're also starting to be able to more deftly eat with their fingers instead of a more rudimentary like hand to mouth open palm eating style. They're more deft with picking out little smaller pieces of food. And we see language skills start to really make some leaps and bounds. So they're able to say 3+ words in addition to that original mama or dada. Parents should also make sure they're helping their child out by pointing to objects, naming them wherever they go. If you're in a car, point out the cow, the billboard, the other cars. This is going to help these kids to add to their vocabulary and gradually start to expand it. Now, regarding social and cognitive skills, these 18 months old are able to follow one-step commands that we talked about earlier, but without that supplementary gesture. So in the past, we had to say, go get your socks and point to them, or say, go put it on your shoes and point to them. Now these children are able to understand what you mean simply by stating the command, and you don't need to add that supplemental gesture. They also start to imitate here around 18 months, something that we really see. They're very fast learners, so you do have to be really careful with what you say and make sure you leave out some things that you would not want an 18-month-old to mimic. They'll mimic actions as well as words, and it's their way of learning. Alrighty, so we're going to jump to 2 years now. We're moving on to 24 months. I see that Purple Spring on Instagram passed their NCLEX. Congratulations. That is so exciting. That is the end goal of why we are all here today, so we are happy to see it. Thanks for letting us know. So 24 months, what's going on here? So gross motor skills. Previously, these infants, kids, toddlers were just able to confidently walk on their own. Now they're starting to progress past that. They can start to run, start kind of really grossly kicking balls, not super deftly, and they're even starting to walk upstairs. Essentially, these infants are getting a lot harder to keep up with. Regarding fine motor skills, they're able to use a spoon independently to feed themselves and keep food on that spoon all the way up until it reaches their mouth. Language skills also see some big development. So now that these 2-year-old are able to kind of say 2-word sentences, and that's a good way to remember 2-word sentences, 2-year-old. So they can identify things like little dog for a stuffed animal or purple book if they're looking at a book on the shelf. We see leaps and bounds develop with our social and cognitive skills as well. So at 24 months or 2 years, these children are going to be able to know 2 different body parts. If you were to ask them, where are your eyes? They'd be able to point to their eyes. They're starting to develop some awareness of their body and understand what body parts are. And here's where at this 2 years of age, we typically see parallel play start to be exhibited, which again, we talked about it a little bit earlier, but you're playing side by side with someone. You're not necessarily playing with that child. They may look over, they may observe, they may mimic, but they're playing, doing their own things simply next to one another. And again, 2 years of age is where we see this start to be exhibited. Alrighty, so moving on, we now have our full developmental milestones tables, and we're going to hone in on that 30-month, which again is 2.5 years. So here in our gross motor skills, a big improvement we see here is now these kids are able to jump. They've developed some more muscle strength and they're able to put it all together in order to jump. Regarding fine motor skills, they're able to start removing their own clothes. They can't quite get dressed by themselves or put the clothes back on independently, but they are able to remove clothes, which is really important when it comes to readiness for potty training. They're able to turn the pages in the book, although of course they still can't read yet. And language skills, now at 30 months, which is 2.5 years, the vocabulary has expanded to 50 plus words. Again, this is really going to be so much helped by parents naming things, pointing things out, but we see that vocabulary really start to expand. Social and cognitive skills. So now kids are able to follow 2-step commands. We started out with a 1-step command with a supplementary gesture. Then at 2 years, we removed that supplementary gesture, and now they're able to string together 2 different commands, a little bit more complex. So if you said something like, go lay down and take a nap, they would be able to understand that. No promises on if they'll be able to do it. Or take your shoes off and go inside. These 2-step strung together commands, they're going to be able to understand. And also at this point, we see these kids be able to know and name one color, at least one color, most likely their favorite color. Alrighty, so highlighting some differences between 30 months and 3 years. You can again look at this, but we see 30 months is going to be that 2.5 years, 3 years is going to be obviously 36 months. But here at 30 months, they're jumping versus walking upstairs with alternating feet. And then we see at 2 years, they can walk up the stairs. This is most likely going to be 2 feet on the same stair. At 3 years, they do it the normal way, which is where they're starting to realize to put 1 foot per step and progress their way up like a normal adult would. So we definitely see some more things develop around 3 years. They're saying greater than 3-word sentences. Their speech is about 75% intelligible, so you're not going to be able to make out every single thing they say, but the majority of it you will be. They're also going to start to be a little bit more aware of themselves and their surroundings. They know their age, they know their gender, and they're going to start to play with other children and take a little bit more social interest. Alrighty, so nursing interventions. So we talked a lot about these developmental milestones. Now let's put it into terms of what we do with these pediatric clients when they're hospitalized. How can we encourage these developmental milestones when they're in a clinical setting? So we still want to be encouraging these milestones, this growth, even when the child is hospitalized. That is part of our job as nurses. Let us know if anyone here is interested in pediatric nursing. By continuing to provide autonomy, this is really the best way we can allow for these developmental milestones to continue developing. So how do we do this? Incorporate the child into making choices. Obviously, this is going to be within clinical reason. And a great way to do this is to not give them yes or no questions like that, closed-ended questions, because the answer more than likely is going to be no. But we can give them options. So maybe something like, do you want me to give you your morning medications first, or do you want to do your exercises first? That way they have a little bit of bearing in what happens in their day, what happens in their schedule. You can also say something like, should I listen to your lungs first or take your temperature first? That way they feel like they have a little more autonomy and a little bit more control over what happens to them that day. We're going to try and instill a daily routine in the hospital that's as close or similar to the one they do at home. So if they always take a bath before bed, we're going to try to continue that in the hospital. If they always take their morning medications before they brush their teeth, we're also going to try and instill those things in the hospital just to maintain that normalcy and that sense of a typical schedule. These clients should still be allowed to keep their comfort items at hand. 1 to 3-year-olds take a lot of comfort in stuffed animals, blankets, dolls, things like that, and we should always be encouraging that. After all, a hospital or clinical setting is pretty austere and scary, and we want to make sure we're still incorporating things that provide this child comforts. All procedures need to be explained immediately before the procedure. So of course we can let them know it's going to happen much beforehand. They deserve to know what's going on and why we need to do it. However, at ages 1 to 3, their concept of time is not particularly reliable. If you explain a procedure the day before it happens, odds are the next day when it comes up, they're not going to be likely to remember it. So we can explain it beforehand, but we also have to make sure we explain the whole thing in depth immediately before, because we just can't rely on their sense of time. Teaching. Okay, so what are some key teaching points here? We want to keep encouraging parallel play. It encourages them to be around other toddlers, help encourage that social development. They mimic, they observe, they learn a lot from this. And we can do this through activities that are really enriching, like water and sand activities that are really tactile is enriching for a child of this age. Any kind of art activities, as well as interactive toys like dolls and trucks and cars. Different children are drawn towards different things, but these are all great ways to help continue this development by encouraging that parallel play. We also want to start to form strategies for meals. So toddlers are notoriously picky eaters. We want to figure out a routine that works for eating for each child. It's important to know that kids really have a good understanding of when they're full, and typically they do not like to eat past once they're already full. They know when they're full, and if they say that they're full, we don't want to encourage them to eat past that. Because they're so small, they only require roughly 1,200 calories a day. Caregivers should not pressure them to eat more once the child already identifies that they feel full. It is important to give choices, however, maybe provide 2 to 3 different healthy options for the child to choose between. Again, this fosters that sense of autonomy. And we want to make sure we maintain small portions. So each portion should be about 1 to 2 tablespoons for this age. So that's a pretty small serving, especially by an adult standard, but this is pretty much the most they're going to be able to take in of each food on the plate. Too much food or too large of portions can be overwhelming for toddlers, so smaller portions really helps to help with some of this picky eating. We also want to keep exposing them to new foods. Now, this may not always go great at the beginning, but this will eventually help us to expand what they're willing to eat. They may need a few different exposures to a new food before they become comfortable eating it and really work it into their regimen. The first exposure, they may just be getting used to the smell. The second time, they're just be getting used to the texture before they're fully able to incorporate it into their diet. We also want to avoid distractions at mealtime. So toddlers' attention can be very easily diverted. We want to make sure we limit interruption like TV, toys, things going on, loud people talking. We want to make sure they're not distracted at mealtime so they know to eat and finish their plate if they are able to. Alrighty, and a really big thing here is going to be monitoring for readiness for toilet training. At that toddler age, toilet training is a big, big milestone to meet. Our key signs to monitor for that are going to tell us that this child is showing signs that they're ready to be toilet trained includes remaining dry in their diaper for several hours or all throughout their nap time. This means about 2 to 3 hours consistently of maintaining a dry diaper. Also, when they start to be able to independently pull up their pants or pull down their pants, once they're able to do this, it shows they're able to independently start to learn to go to the bathroom. And if they imitate the toilet habits of an older adult, maybe a sibling in the house, this is another sign to monitor for. That's a sign of toilet training readiness. They also might start to show or express interest in toilet training. Maybe they start to go into the bathroom and sit on the toilet, or they take a lot of interest in what's in the bathroom, what happens in here. And maybe even they start communicating, I want to use the bathroom, I have to use the bathroom. These are all things that show us this child is ready to start toilet training. They should be functionally able to walk to the toilet independently, sit down on the toilet for a few minutes before we're going to start toilet training them, just to set them up for success. Alrighty, now our largest portion of today's lecture is safety teaching. Now, these toddlers still are not fully developed. They have a knack for getting into things, so it takes a lot of work, a lot of baby proofing, a lot of pre-planning to make sure we keep them safe. They are curious by nature. They're also starting to walk and act more independently, so it's a really important time to educate about safety accidents and how we can prevent them from happening. Alrighty, so let's prevent ingestion injuries. These are really, really dangerous. I know we all hear about how dangerous those button batteries are, but the things like batteries, like medications, like cleaning agents, they need to be locked up and kept out of a toddler's reach. So not only should it be in a locked cabinet, it should be in a high cabinet that the toddler would not be able to reach at their size. We want to prevent other injuries that are like knife injuries, scissor injuries, anything that can be stabbing or cutting. So we want to make sure we keep those locked up, out of reach. Drawers that have silverware in them need to be childproof locked and ideally up a little bit higher. We also want to prevent burns. So how we can do this, children are very susceptible to burns. We want to set the maximum water temperature in our water heaters to the house at 120 degrees max, no higher than that. Whenever we cook on the stove, we want to make sure that pots and pans, every handle on the stove faces away so a toddler isn't able to reach up, grab it, and pull the hot material down onto them. So handles should face the back wall of the stove. Nothing should be readily available to be grabbed off the stove. Cover all electrical outlets to prevent electrical burn and, of course, electrocution. And also a really important thing to do that can seem so benign is managing the water, especially the standing water. So pools, so importantly, need to be fenced in. Doors to the pool should always be locked. Ideally, the lock is going to be a little bit up higher. This can also mean just small amounts of water, like toilets, bathtubs, and showers. Unfortunately, because of their size, toddlers can drown in as little as a few inches of water. Even a small bucket of water should be emptied, should never be kept out to avoid drowning injury. Choking hazards, also a really big thing here. So we always want to cut foods that could potentially cause choking. And a lot of these ones kind of slip through the cracks. So hot dogs, if you think about that, it's like exactly the size as a small child's airway. We don't just want to cut them horizontally, we also want to cut it vertically. Same things with grapes. That's just the exact size of a toddler's airway. These should be cut horizontally and vertically as well. Even though these foods seem small enough already, we always want to go that extra mile just to make sure that nothing gets stuck in the child's airway if it's a similar size to the child's airway. Properly installing car seats is our last safety teaching point as well. We want to make sure we install them according to product guidelines and that they're appropriate to the child's weight as well as their height. And usually there will be different rules based on both. Car seats should always be discarded after any accidents. And I also see people cut the seat belts so other people who find the car seats know that there's no way this should be secondhand used in a different car. Once you're in any car accident, no matter how minor, you do have to discard the car seat. And other great resources to remind parents and caregivers about is that if you go to a fire station, they're trained to help parents properly install and load their car seats. So really great, I feel like little known resource that we can impart to our clients. Alrighty, so that was a lot of information, but you all did so well. Let me jump into the chat and see what everyone is thinking. Do we have any more NCLEX passers? Alrighty. Oh, someone said, Fahim says, NCLEX scheduled this week. Any tips? You're going to do great. Stay calm, be confident. You got this. I believe in you. Trust in your own abilities. Alrighty, so now that we've covered the lecture material, let's go ahead and jump on to our first question of the day. So let's test out our knowledge. Here, the nurse is screening pediatric clients for autism spectrum disorder. It would require follow-up if, option 1, a 9-month-old client has not developed a strong pincer grasp. 2, a 17-month-old client cannot kick a ball. 3, a 24-month-old client lacks spontaneous eye contact. Or 4, a 36-month-old client cannot hop on one foot. Drop your answers into the chat, 1, 2, 3, or 4. Let us know what you all think. We also have another NSNA webinar coming up next Monday, July the 14th. It's going to be myself and Nurse Nkoli. We're going to cover Select All That Apply and Prioritization Questions Strategy, which we get a lot of asks for more strategy, test-taking tips like material, and we are trying to meet that need. And then the back end, I will be covering obstetrics with a lecture and then some practice questions. So again, that's July 14th, next Monday, 11 to 1 p.m. Central Standard Time. You can find more information on the NSNA's social media or on our social media, but we're really excited for that. Next Monday, July 14th, 11 a.m. Let me say it before I forget it. Alrighty, lots of answers coming in. You guys are doing fabulous today. Thank you so, so much for participating. And you guys are spot on. No surprise there, you guys always are. Option 3 is our correct option here. So we're screening clients for autism spectrum disorder. Essentially, we're looking for deficits in development here that might be signature of this client needs to be further investigated for autism spectrum disorder. So option 1 was incorrect. A 9-month-old client has not developed a strong pincer grasp. This usually develops by 12 months of age. So if a child's not quite doing this yet at 9 months, we're not worried about it. Nothing to worry, follow up, or fret about here. If a child were already doing this at 9 months, it would simply mean that they were ahead of the curve. So nothing to follow up here. Option 2, a 17-month-old client cannot kick a ball. Kicking a ball develops closer to 2 years of age. So at 17 months, that's not the 24 months or 2 years. We're not worried if a child has not mastered this yet. Option 3, our correct answer, a 24-month-old client lacks spontaneous eye contact. Again, this is a finding that should already be developed by 2 years of age, meaning that there's a developmental deficit here. This would require follow-up for potential autism spectrum disorder. And lastly, option 4, our last incorrect option, hopping on one foot. A 36-month-old client can't do it yet. Hopping on one foot does not typically develop until around 5 years of age. So 36 months is 3 years. If they're not doing this yet, we're not worried. We don't need to follow up yet. They still have quite a bit of time to figure this one out. So again, correct option was option number 3. I see someone said that a question like this was on their HESI. Well, I hope you got it right, because you got it right here. Man, HESIs were so hard for me. I thought that the NCLEX was easier than the HESI. Alrighty, question number 2. Let's look what we have here. The nurse is assessing a 2-year-old client. Which of the following findings would require a follow-up? So option 1 is walks with assistance. 2 is identifies 2 body parts. 3 uses a spoon during meals. And 4, able to say 2-word phrases. Drop those answers in the chat. Let us know what you all are thinking. And keep let me know who here takes the HESI, who here takes the ATI. Let us know. I know every school does something a little bit differently. Maybe there's one I'm not even mentioning. Oh, T's, isn't that another one? Let us know. Did you take your HESIs, your T's, or your ATI? Someone says, I don't see the question you're reading to us. It is up now, so no worries. And someone says, ATI. I have not heard a lot about that one. I see someone say T's and ATI, ATI. Lots of ATI, wow. I guess not as many HESI takers. I'm not really sure what the difference is there, to be honest. Alrighty, and someone is waiting to take their NCLEX. Good luck, you're gonna do great. They graduated on the 27th. Congratulations. That is so exciting. Congrats on all of your hard work. Oh, I see one HESI. Alrighty. Evening out the boards here. Alrighty, lots of great answers coming in. At the beginning, it looked like you guys were a little bit more all over the place, but by the end, it looks like you all figured this one out. Way to go. Our correct option was option number 1. So, which of the findings requires follow-up? Again, this is another negatively worded question, meaning we're looking for an incorrect answer. We were looking for something that requires follow-up, meaning further intervention. We need to look into this a little bit more. So that correct option was option 1, walks with assistance. So by the age of 2, our client really needs to be walking independently. We've outgrown that cruising stage, which is when that they're holding on to furniture, a chair, a couch, or maybe a caregiver in order to walk. By the age of 2, they should be walking independently. So we would want to follow up option number 1 to see if there's anything concerning going on, maybe a neurological deficit, a developmental deficit, or something happening in the musculoskeletal system, but this does warrant our follow-up. Options 2, 3, and 4 are all expected findings for a 2-year-old client, therefore we don't need to follow them up. So way to go, you guys. Great job today. We're going to switch by our QBank slide really quick. For anyone who's already using UWorld, here's how you can get more questions based on what we talked about today. So here's our QBank. Here's how you filter more questions for childhood developmental milestones. For anyone that does not use UWorld or has never seen it, here is just one of the many ways you can filter questions throughout our QBank, so you can target exactly what area you are trying to improve and refine. So take it for yourself, take a look and see how UWorld's QBank works. Alrighty, so in closing, thank you for staying tuned. It was so lovely to be with you all today. We were out last week. We did some pre-recorded things, some greatest hits, and we missed you guys, but it is so, so great to be back. So pediatric milestones, they can be really difficult. They all start to kind of blend together at some point. I feel like mastering them does take a little bit of time, effort, and some memorization, but I know you all can do it. Way to go. Again, all these lives are going to be on demand on our social channel. That YouTube channel is typically the easiest one to search. Thank you so much for joining, and I will see you all tomorrow. Bye, guys.